If you're thinking about engaging in online psychological therapy or telehealth psychology, you might be wondering whether online consultations are just as effective as in the consulting room or in person. My name is Chris Basten, clinical psychologist in Sydney, and I'm here to address that question for you. In reality, seeing somebody in person or online is really a matter of personal preference, and the choice that people make is a good predictor of how effective that treatment will be. If you think it's not for you, it's best to find a way to see somebody in person. In our field of psychological therapy, our professional community has developed ways of studying and measuring the effectiveness of certain treatments. And these sorts of studies have indeed shown that online treatment for common conditions like certain anxiety disorders and depression are indeed effective compared to waitlist control, and as effective, or at least nearly as effective, as in-person consultations. Now, these studies, though, have shown not only that the treatments are in principle effective, but they have also demonstrated which elements of treatment make them effective and which elements might lead to low effectiveness. So you might want to know about that. We can break these factors down into therapist variables and client variables. To make it effective, a good client will be very focused on outcomes and will structure the session well. Online, a good therapist will try to replicate a professional consulting space. They will keep notes and communicate well with their client, help stay on track with goals, and they'll be flexible and creative, really trying to adapt the key elements that we know are effective treatment ingredients that lead to actual change. Talking therapy on its own usually doesn't help. Getting things off your chest isn't therapy, that's just counselling. You can do that with friends. We need to do treatment active ingredients in order to get real results. And these need to be adapted for the online environment. A good therapist, finally, will also be listening to and willing to hear from their client about how the therapeutic relationship is getting along, and willing to change in response to that feedback. Client variables include an ability to set an agenda and also to stay on track. I think the most important variable for clients is a willingness to work hard in between consultations. There is a good chance that your therapist will set some goals and exercises and homework, and the more you engage in them, the more you get out of therapy. It also helps to create a professional therapeutic space at home for the consultations, to make sure it's private and effective, and to set up some regular time when you can work on things in between your consultations. So, does online therapy work as well as in person? The answer is, for the most part, yes, but there are some conditions where it is not quite as effective, such as certain anxiety disorders. And some people may just find that it's not their personal preference, and they will get better outcomes if they work with somebody in person. I encourage you to give it a go if you're not sure. A good idea would just be to meet your therapist online and have a chat. If you're thinking about contacting us, you can do so at our website. It's www.bastenpsychology.com.au. Hope to see you soon. Look after yourself and everybody close to you.